blood trace from our hand or our fingers all the way down to our toes, okay? So we're going to start here by looking at our hand. So let me remove some of this connective tissue and zoom in here. We're going to start with our proper digital veins here. So these are these little veins here, our palmar digital veins that are along our digits here. These transition into a common palmar in our venous arches. So we have a superficial and a deep palmar venous arch. You should just be aware of them being referred to as palmar venous arches. And so if I can click here, here you can see the superficial, and here you can see the deep. And if we look on the dorsal side of the hand, there's actually a dorsal venous arch as well, right here, if I can click on it. So there's our dorsal venous arch, okay? We're gonna focus on the palmar side here. And so from here, we can enter into a couple of different veins. All around the hand, there is a strong anastomosing network of vessels, but we're just gonna pick two. We're gonna pick the radial and the ulnar artery. So here we have our ulnar, and here we have our radial. And if we follow these superiorly or proximally, here you can follow the radial, and here you can follow the ulnar as it comes. And you see they both meet at this junction, the radial and the ulnar, with this one here, which is our brachial vein, okay? Our brachial vein here. From here, our brachial vein will travel proximally and drain into this structure here, which is our axillary vein, okay? Axillary vein continues in the axillary region under the clavicle to become the subclavian vein here. From the subclavian vein, we become our brachiocephalic vein that gets blood from the head and the limb, hence its name brachio and cephalic. If we had the manubrium here, from our brachiocephalic vein, we become our superior vena cava, okay? From our superior vena cava, we know that we go into our right atrium, right? From our right atrium, we go through our tricuspid valve. From our tricuspid valve, we enter into our right ventricle. Right ventricle, we leave through the pulmonic valve and into the pulmonary trunk, and then to left and right pulmonary arteries, to the lungs. From the lungs, we return via pulmonary veins. So you can see left pulmonary veins and right pulmonary veins, and those drain into the left atrium. From our left atrium, we enter into our mitral or bicuspid valve here. We then enter into our left ventricle. From our left ventricle, we go up and out our aortic valve or our aortic semilunar valve into our ascending aorta here. We go to our aortic arch, and then from here, we'll begin our journey inferiorly toward the foot. So if we go here, let me find here. So we are now going to be making our way from the heart down to the foot. So we started here at the heart, we went up and out of our ascending aorta, aortic arch, and now we're going to be in our descending thoracic aorta, traveling through our thoracic cavity. We'll transition into our descending abdominal aorta. If we rotate to an anterior view here, you can pick either leg. You can be going left or right. It's going to be the same no matter what. We'll enter into our common iliac here. Oops, I clicked the wrong spot. Common iliac here and common iliac here on the left side as well. From there, we will transition into our external iliac. Our external iliac has essentially a seamless transition with this next, let me add some bone back here for reference, with our next vessel called our femoral artery here. There's a inguinal ligament. If I add this back, this ligament here, as soon as the external iliac passes underneath this inguinal ligament, it changes name from external iliac to femoral. So you can see that at that transition, it's right about at that inguinal ligament. So now we're in our femoral artery. From our femoral artery, we work our way down, and we transition into another artery that travels just posteriorly to the knee called our popliteal artery, okay? So we're gonna swing around here, and we'll take a look at our popliteal artery as it enters into this popliteal fossa. And from here, we have three main branches that you can transition into. we can go into an anterior and a posterior tibial branch. So here's our anterior, and here is our posterior. And then off of our posterior, we have a third one called the fibular branch, okay, sometimes called the peroneal branch as well. Peroneal referring to the fibula. So we'll just pick our anterior tibial for this one, okay? We're going to go back to an anterior view. We're going to follow our anterior tibial artery down, and this will transition into something known as the dorsalis pedis artery. So if I hide some of this connective tissue again, we're here in our our anterior tibial. This vessel here is going to be our dorsalis pedis, okay, this one right here. From our dorsalis pedis, we transition into these dorsal metatarsal branches. So you can see all of these are your metatarsal bones here. So these that run right next to them are your dorsal metatarsal arteries. From here, we go into our digital. So we have a common and a proper digital artery here. Okay, so we have digital artery here, a common dorsal, and then we have our dorsal digital here as well. Okay, so that's going to be the walk through and the blood trace from our hand to our foot.